Occupational therapy is a healthcare profession that focuses on independence in everyday living. Our primary goal is to help people develop the skills needed to participate in day-to-day activities when these activities are limited by injury, illness, chronic disease states, mental health issues, developmental delays, or other health issues.
At the Child Development Center, occupational therapists help children succeed in their daily occupations. We help him or her achieve success at school and at home. We often work on skills such as gross motor skills, fine motor skills, printing skills, play skills, and self-regulation skills. Therapy is based on a multisensory play model. We use play to expand a child's skill set. For example, when we work with a child with printing difficulties, we don't just sit at the table and print, but we also participate in a variety of gross motor and visual perceptual games that incorporate a kinesthetic approach to learning how to print. Or if that child has difficulty sitting at the table, we provide the child with lots of movement and sensory experience to help organize their neurological system so that they can then come to the table and work.
Occupational therapists provide assessment, treatment, and consultation to patients in acute care. These patients may have experienced a sudden decline in function due to their acute medical illness. Occupational therapists use a client-centered approach which focuses on identifying what the client needs and wants to do. OTs may provide training in self-care activities, such as bathing and dressing, with recommendations for safety equipment, or address cognitive and perceptual deficits, complete arm and hand function exercises, or provide falls prevention strategies. Occupational therapists in acute care will consider a patient's discharge destination and the need for adaptive equipment or modifications to facilitate maximal safety and independence when they leave the hospital.
In the hand therapy program at Michael Garron Hospital, occupational therapists work with the hand and plastics team to provide assessment and treatment of clients of all ages who sustain acute hand injuries or require hand surgery. The main goal of occupational therapy in the hand therapy program is to optimize hand function. Hand function is vital to most of the everyday activities we perform, such as eating, getting dressed, typing, driving, or participating in sports. Any hand injury or impairment can limit our ability to participate in these tasks. Occupational therapists employ a variety of techniques and interventions to help clients return to their highest level of function. These include patient education, activity and exercise programs, fabrication of custom hand splints, adaptive equipment recommendations, hydrotherapy, and management of pain, swelling, wounds, and scars.
The Complex Continuing Care Service covers a wide range of programs, including general complex continuing care, chronic ventilator-assisted care, alternate level of care, inpatient short-term rehab, palliative care, the memory care unit, and acute care of the elderly. The OTs work across all of these areas. The focus is on improving patients' independence with their activities of daily living. In the course of the day, the OT may assess cognition, check how patients manage their personal care, and set up patients with specialized wheelchairs. OTs work with the interdisciplinary team to create safe discharge plans for our patients, recommending equipment and connecting them with appropriate services in the community.
Occupational therapists in mental health work within multidisciplinary teams on the inpatient and outpatient mental health service, day treatment program, aftercare program, and the assertive community treatment team. Occupational therapists use both a client-centered and recovery-oriented approach to assist individuals, their families, and groups to develop meaningful goals in the areas of self-care, productivity, and leisure. The primary goal is to increase an individual's ability to live as independently as possible in the community while engaging in meaningful and productive life roles. Interventions may be targeted at building specific skills. These include skills needed for independent living, such as using community resources, managing one's home, and managing time. Additional areas of focus may include interpersonal and social skills, leisure counseling, stress management, and creative art. OTs assume an active role in advocating for their clients.
At Michael Garron Hospital, occupational therapists and occupational therapy assistants are members of the interdisciplinary healthcare team and work across many areas in the organization, providing both inpatient and outpatient care.